Hello, friends. Welcome to the Veterinary Life Coach Podcast. Today, I have a beautiful guest for you. Her name is Dr. Maggie Yu, and she's a highly respected family physician, a certified functional medicine physician. And over the past 16 and a half years, she's been providing education and training on topics related to longevity and reversing chronic diseases through various media platforms. And she's going to tell us more and more about that, plus about some pet nutrition as well, which I'm really excited about. Welcome to the podcast, Maggie. It's okay if I call you Maggie?
Absolutely, Julie.
Okay,
Thank
awesome.
you. I'm excited to be here. Veterinary medicine, holistic pet health, and nutrition is a binge passion of mine. So
Oh,
I'm
that's
thrilled
awesome.
to be here.
All right. Well, my first question always is to all of my guests is to tell me their story. So
Mm.
tell me as much or as little as you want to tell about wherever you want to go.
Absolutely. So I am 54 years old. I am what we call a functional medicine physician. And in the veterinary world, I'm sure you guys would refer in a provider like this to be a holistic veterinarian. I do that for humans.
Okay.
Right, as a functional medicine physician. What I like to say is I combine all my scientific training as a family medicine physician with all my own personal experience and training and wisdom over the last, 28 years in practice. I put it
I know.
together
You want to
and
say
that's what,
that quietly, right?
yeah. And so badge of honor. And so I put that together. I like to say I put on my MD smarts with all my personal experience and training as a holistic physician as well. And I put it together and I help people really uncover really solutions to invisible problems, chronic health problems that are devastating.
Yeah.
So I'm fascinated by that because that happened to me. And at 36, I went into early menopause. And I'll even backtrack with the birth of each of my children. I developed more and more problems that were difficult to explain through my own medical training. I developed chronic fatigue, hair loss, weight gain, depression, brain fog with ADD symptoms, chronic pain, TMJ, neuropathy. It just kept adding to the point where at the age of 36, I went into early menopause and I was
Oh,
told by my GYN colleagues, and I was told what I would have told people, you know what, Maggie, you're just getting older. And I was 36, not 86.
right.
Right. And so there was something wrong here. And, it got so bad that, I, had trouble performing in my job as a medical director in a family medicine clinic for a large medical group. So, at that time at 38, I lost my job, I lost my marriage, and I nearly lost my life.
Wow.
Mm-hmm. And there's nothing like hitting rock bottom like that that really causes you to, at that point, say, I'm smart and I can't be any lower than this. There's got to be a way out of this. What can I do? And I was
Yeah.
willing to do anything and everything at that point because this is my life and also my children's,
Right.
right?
Yeah. Something needs
So
to change, right?
that really prompted me to learn a lot more about testing for bioidentical hormones, what's really going on with that. Oprah, Suzanne Summers was starting to go, people thought bioidentical hormones or testing for hormones was crazy. But at the same time, I knew there was something really wrong. So through my foray into that, I became in Portland, Oregon, a medical physician, that one of the few medical doctors that knew anything about testing hormones, prescribing bioidentical hormones. And that really helped turn things all around for me a lot, except it didn't. I found that it helped for a while and then it didn't. And then I uncovered that there were layers of autoimmune disease that was
Mm.
happening for me and hundreds and hundreds of patients that I was treating, where you can give them a thyroid medication or you can give them hormones, but then you keep chasing it and chasing the symptoms and it keeps going, going, going. And underneath it was actually autoimmune issues or other types of inflammatory conditions with which we didn't do anything about.
Mm.
So it was through understanding, how do you turn off these inflammatory processes? How do you stop autoimmune attack? That really lit my fire, that delivered finally the solutions I needed for my life. And once I was able to save my own life and I was working with all these people with hormonal issues, I realized I ended up having the largest autoimmune clinic in the state of Oregon with
Wow.
12,000 patients. And we ended up having a clinic that had medical providers and naturopathic physicians working together, case study style, on how can we integrate the two. And that was the birth. And since then, I no longer do a in-person clinic. What I do now is online programs where I work with people around the world with an online format, and I teach. I coach, I teach, I work with clients all around the world. I even train providers on how to do this. So this is where I ended up here because, man, I love to share this on social media, share the stories, and really get this knowledge out there, the wisdom and the stories out there, because connection is my number one value.
Yeah. And you fixed yourself.
100%. I saved my life multiple
Yeah.
times.
Yeah, that's amazing.
Mm-hmm.
So tell me how to start. Like, how would somebody who's listening to us saying, "Oh yeah, I have that, I have that. I don't feel great." How,
Yeah.
where would you start with somebody? And
Well, so here's the interesting thing. I know you're in your audience and you veterinarians dealing with animals.
yes.
And so I want to actually have you guys take a look at what you do day to day with your animals.
Okay.
Like how we as providers, physicians for our animals, right? Start to think about this. How often do you see problems that the prescription or the way that you were taught doesn't really address this problem, doesn't really solve the problem, or is in fact causing more problems? I mean, do you notice some of the prescriptions that you're prescribing is, maybe temporary dealing with some of the symptoms, but in your heart that, there's more to this and this dog's fluctuating thyroid medications, and yet their symptoms are going on and on and on. Guys, it's autoimmune,
Right.
right? What are we doing to actually address the immune system of these animals or the autoimmunity, the misguided immune system in these animals?
Right.
Nothing, right? And
Right.
now take that corollary and now apply it to your own health. How many of you listening and watching out there are dealing with symptoms like chronic fatigue, brain fog, hormonal imbalances? You got thyroid issues, right? And yet just taking the medication isn't addressing what's going on
Right.
with things like, wow, like you never had ADD as a diagnosis or this level of irritability, but now you do, right? But you're like, I'm going to the doctor, I'm getting the standard blood test, and it's not helping me solve my problems.
Yeah.
I
And
want
usually they're just giving you another drug, right?
We're treating our animals the way we're treating you. And in some ways, maybe we're treating animals even better the way you're treating yourself.
Right.
Right. So when I look at how you're treating your animals and you're realizing that there's deeper root causes to these problems, what are you doing to figure this out? And I see many veterinarians starting to ask these questions and getting additional training, right? And we have to do that in our own health. So I tell people, and whether you're a veterinarian, a doctor, or somebody who has no medical background whatsoever, when you start dealing with these invisible symptoms or impossible and vague symptoms, or you have diagnoses like autoimmune disease, POTS, dysautonomia, mast cell activation, histamine intolerance. These are all the buzzwords of symptoms that clients are dealing with that they have no answers to. There is no answer in conventional medicine to. So the first step is to listen to a podcast like this,
I
to
love it.
search, like I'm serious,
Yeah.
to search out and look for, if let's say you think you suspect I have vertigo, I have dizziness, I might have POTS, or maybe this is the first time you heard the word, search out on YouTube, right? And search for, people often ask me, what are reliable sources? You know what? In the veterinarian world, you guys know already there's certain YouTube channels and certain holistic vets. And I know them because I follow them and I watch them. And
Right.
they're providing some really valuable scientific based and clinically they deliver care to the animals that they're speaking truth, hard truth out there. There are pioneers out there in the veterinarian world, holistic veterinarian world, that are great on YouTube, right? And so there are physicians that are great on YouTube, but not many of us, but there are those of us who are sharing our knowledge, whether it's from an MD scientific side of it, but our holistic education as well, and our clinical knowledge in dealing with patients with symptoms 10 times worse than yours. I have
Right.
people on the transplant list we work with. So
Wow.
seek out those resources because your curiosity is going to be the leader in this, and your education from reliable sources is going to be the answer.
That's amazing. I love it.
Mm-hmm.
So go to YouTube.
Go to YouTube, right?
Yeah.
Go check out my YouTube channel. My name
Yeah.
is Maggie Yu, MD, and we have almost at this point 1,500 videos And if you look at my case studies, we have about 400 case studies that are already in there. We record 1 to 2 case studies a week of people with impossible to treat symptoms or diagnosis that for me, I eat for breakfast. So, like proof, get yourself educated, look at proof, see how other people who've been successful have dealt with these problems. Because success, don't just leave clues, success lights a pathway.
Yeah, yeah. So do you think that it's all nutrition based? Is it
No.
stuff that we're exposed to in the environment? What is since I haven't watched your videos yet, and now I have to, what is your theory and why all this is
Well,
happening to and the pets?
it's not a theory, it's facts. And
Okay, what are your
factually,
facts?
here
Yeah,
are the facts. Factually, when we're looking at, let's say, I'll give you an example. In pets, we're dealing with a lot of symptoms that we know, you guys know as veterinarians, is related to the food they're consuming.
right.
There is that absolutely 100%. How can what they eat not have anything to do with their symptoms? You guys know as vets. I mean, recurrent ear infections in dogs. Think about that. Like, is it really just a recurrent? Is it just an anatomical shape of the ear of specific breeds?
No, we know
No.
that's not true.
We know that's not true. Okay. We know that there is a dietary component to something as simple as recurrent infections in dogs.
Right.
And if someone asks you, is it all nutrition based and is it all food based? I think that is definitely part of the issue, right? We know that. But
Probably
the
a big
question is
part.
how, right?
Right.
And how do you get to that answer? And so I think that in these chronic health symptoms, 100% like food has to be part of the answer. And the question for me, though, is that there are even with food and nutrition layers to this. Because to me, I'm one of the only functional medicine physicians in dealing with people that says digestion is a huge part of this issue.
Mm,
It's
yes.
digestion. Innately in digestion, in every one of you and every one of your animals, they're born with, we got like, let's say 10 steps in digestion. Genetically, certain breeds have weaker digestion at certain steps. We know this. We know poodles have, irritable stomachs and irritable bowels. We know certain breeds, right?
Right.
So there's a digestion component that there is a genetic basis to it, breed basis to it. Human, we have, certain tribes like Hispanic population have fat digestion problems. I'm going
Mm,
to tell you that right now. This is why, in when I see, just like you guys will look at poodles and already make certain assumptions, I can look at the genetics of like, oh, Hispanic background, woman in her 40s, right? No matter what the symptom is, I'm going to tell you her lack of fat digestion is going to be part of this problem. But yet, I'm one of the only physicians that will even think about
we'll
this,
call that out. Yeah.
right? And when we say that, there's certain genetic basis to it. But the problem is these individuals will go to doctors and say, I have heartburn, I have bloating, and then they're prescribed a medication for that symptom. And we
Right.
use these on animals. So
Yes.
let's talk about like Prilosec, the purple pill, Zantac, Pepcid. These are antacids, right? That we use to treat that symptom because that's what we're taught.
Right.
But what we're really doing is shutting off completely one of the major, most important steps in digestion. Think about that. What is the point of acid in digestion in animals and in humans? One of the reasons is acid sterilizes and clean. Why do we use vinegar and water to clean surfaces?
Right.
So think about this. If the dog or a human has a broken step or multiple steps in digestion that's broken, there is a reason why that particular dog or dog breed has recurrent ear infections because part of their defense against infection is literally gone
Is that
or
work?
it's iatrogenically introduced because of medications you prescribed.
Right.
Both. Typically is both. Right. So doesn't it get complex then to say, is it food and nutrition related? Yes, it is. And there's a whole aspect of that. But what about digestion as a problem that we don't teach veterinarians and doctors on how to address in the first place?
Yeah.
Julie, what do you think of that?
I think it's genius. And it's true. I mean, we don't think of that. We take after the human medical profession and throw drugs at dogs. I mean, that's the truth.
Correct. And we are doing the same thing with humans.
Yeah.
So I want to use a corollary here that every single person in your audience can understand, and in my audience can understand, which is, oh my gosh, I am a science nerd when it comes to digestion. And I want to make these concepts in functional or holistic medicine and holistic veterinarian medicine stupidly simple for everybody to understand.
Right.
Right. And you can already see right now that, this is why for me, when I work with individuals and in all our programs, we got to teach people about these steps in digestion, what they are, there's a genetic basis to it. There's also an environmental factor with drugs that you're prescribed. And layer on top of this, could there be certain infections that actually break other steps in digestion in humans or in animals? And the answer is yes. So we already know in humans there's H. pylori infections that animals could also be carriers for, just so you know.
Absolutely.
Okay?
Yeah.
Right? And H. pylori in humans, that type of infection is actually known to trigger ulcers. Right? And there are many mechanisms to it, but let's say you have poor digestion. Now you're not defending yourself against infection of the H. pylori or COVID for that matter. And then now these infections come in and they can break further steps in digestion, right? So now there's more environmental factors that come in. And then I'm also going to add to this hormones, right? Hormones really matter in humans and in animals, right? And hormones just isn't just, one TSH in your animal or one TSH in your human. Like we know the thyroid also work with in humans and in animals are ovarian and testicular hormones. Animals and humans have adrenals. We have brain hormones and we have gut hormones.
Right.
Right. And so this whole hormonal piece in humans is ignored, and it's ignored in veterinarian medicine.
Right.
So even in digestion, there are gut hormones that are speaking and working with all the other hormonal systems to help digestion. So your dog with low thyroid and your human with low thyroid isn't just having just a thyroid hormone problem.
Right.
They're having other hormone problems, including the hormones that help and regulate gut motility and gut digestion. The plot thickens.
Right.
And I just talked about digestion, right? Now we're going into hormones. And then I'm going to layer in more because we're talking about recurrent infections in dogs and as an example.
Right.
Well, we now know, you guys know, we start sending them to what? Dermatology or allergy dermatology, who now has become the
allergy testing,
allergist of the veterinarian world.
Right.
Right. And so now that's becomes more standard of care with recurrent dog infections to start sending them to dermatologists and the allergists, ear, nose, and throat kind of with dogs. And then they're now starting to look at, oh my gosh, food allergy has a lot to do with this.
Mm-hmm.
Food allergy has a lot to do with everything, peeps, right? Because canned food, and we already know, come on, every single one of you veterinarians out there know that there are animals that are experiencing many health symptoms, and it's food allergy. How many of you have, and I hope many of you have, even suggested that chicken allergy is one of the most common allergies in dogs, and yet it's the most common component of the protein component in our pet food.
Of the food, yeah.
Right?
Which makes sense because they've been exposed to it for years, and yeah.
Correct. Mm-hmm. So I'm going to say that food allergy absolutely is a problem because we know that when you have an increased histamine production in histamine, which is allergic reaction in your animals, can the eustachian tube in the ears get clogged more? Can there be more swelling around the ears, which makes more a warm, moist environment for fungus or bacteria to live in?
Yeah. Absolutely. Mm-hmm.
So food allergy in dogs, cats, animals, huge. Food allergies in humans, crazy ass. Right? And yet we send them to the allergist, and the allergist in our world, all they care is a skin test or a blood test for IgE allergy only. And if you're negative there, you're shit out of luck, you're crazy.
Right.
Okay. In the veterinarian world, I don't know if it's only IgE testing that they do, or they even consider the role of food sensitivities, because there are different branches of the allergy system.
Right.
Just like there are different branches of the military, There's IgG, there's IgE, there's IgA, and there is pros and cons to testing those, and there's foes and follies with all of those. And yet, if all it is going to be IgE testing with your dermatologist for your dog, you're missing the other 50% of the picture.
Right.
And in the holistic vet world and in the holistic medicine world, doctors don't know how to test accurately for food sensitivities, which is mostly what we're talking about is IgG and IgA. Many of the reactions that we see in animals and in humans are delayed allergic reaction, which means they're not IgE, they're IgG or IgA. Okay. And so the technology and the training in veterinarians and MDs are lacking to properly diagnose and treat food sensitivities that are IgG and IgA related.
Right.
This is where I come in. Right. So for me, I look at the shit show that is right now, food sensitivities that our allergists, IgE allergists denies exist. And yet our functional and holistic medicine physicians and naturopaths say, yes, it exists. However, testing sucks. So we're going to put everybody on elimination diets.
Right. Yeah.
Right. And
That's
the truth is
with people and animals.
Right. So we start eliminating. And so the thing is, we have so many conditions where people just Google it and they say, just eliminate these 80 foods. And elimination diets in animals and in humans are not healthy. Okay. And especially if they're large elimination diets. How many people with autoimmune disease just says, go on the AIP autoimmune diet, right? And if you look at that diet, it's going to eliminate probably like 60 to 70% of someone's diet. And then they're left here with 30, 40% of diet that's low in diversity, lower in nutritional content, lower in phytonutrients. It's not meant to be long-term, right? And if so, really critically importantly, as a medical doctor and as a scientist, I have figured out a system and a way with which I can figure out what are people's food sensitivities that using their data 100% is what's triggering their chronic diseases, right? So I went through these. I mean, I've probably already tested it. We probably have done about, at this point, about 13, 14,000 tests, patients' samples. And I've tested over 100 different types of food sensitivity testing. And guess what? There are good tests. Not many, but there are good tests, right? But number two, the worst part is people don't realize is when we even use the best tests on humans to test them, the people that are and the animals that are requiring this kind of testing typically have a lot of autoimmune issues, meaning their immune system is hypo responsive. Right. So the problem is, even with the best tests, and you test individuals that don't have a normal immune system, we can get a bunch of what I call noise, which is false positives and false negatives. So what I've learned is to really train every single person we work with, every patient we work with, what is the Rosetta Stone to understanding even the best tests with your results, given your whacked out weird immune system? So that's what I teach. So we've got to it's beyond what is the right test. It's got to be, what are we teaching? Are we able to deliver to clients and to physicians a system for understanding how to understand these crazy ass results? Because I don't know how many times I've told you, even I've seen people, they might have stumbled upon the right test, but they're like, oh, I got tested and I was told 90% and I could see 90% of everything lit up. And so I had to remove 90% of everything in my diet. That's not true. Yeah. It's wrong and it's not true. Either you got a bad test or you had a physician who wasn't trained on how to understand these false positives and negatives to deliver an accurate result. So that's why for me, it's a system, and I call it the food mapping system, where I got to train people on digestion, because 50% of these reactions are digestion related. 50% of it truly is allergy and food sensitivity related. I got to teach people both, so they are able to, with their data over here and with their education over here on digestion, we can sort through, oh, this is digestion related. That's allergy related. That's a false positive. That's a false negative. Here's an exact plan, step by step, for what you're going to do. Right? It's complicated, but this whole thing about even food allergies requires a system with which we can educate physicians and patients exactly on how to understand these results accurately and what are things you need to implement. And it's not just about food allergy. You betcha you got to know about all the digestion pieces here, because there's a big difference between the two. And there are different strategies and tools to address the two. And they need to be combined together. And that's why I call it the food mapping system. It doesn't exist for humans until I created it. And I've worked with this, so many people with this. And I know that for pets, this doesn't exist, because in humans, this is something that's also doesn't exist until I introduced working with clients with this about 10 years ago, based on my own experience and working with clients.
Now, is this something that you then are hoping or doing already to train other physicians?
We have a provider certification program. So yes,
okay.
we also, not only do we work with clients all around the world, because we do this online, right? We do all this online, but we do this in a group setting where we're educating. It's an education based. Because here's a really cool thing. Let's say I'm working with you, Julie, and I'm also working with Kim and her daughter. Really importantly, when I go through your results, Julie, I love the way I teach this, which is case study based, which is I'm going to say, let's look at Julie's data, everybody. And I always say there's 3 sets of data. Number 1, what's Julie's past medical history? Number 2, what are Julie's current symptoms? And then number 3, what is her actual laboratory data? We take all 3 of these and we say, now let's look at the data through that lens. And we say, what are the hidden patterns here none of the physicians out there would ever see? Great. Now, what's the root cause of that pattern? Right? Great. Now, what's every single step that we need to implement, and in what order, all these different tools to solve Julie's problem? Great. When Julie's done, we say, hey, Kim, let's take a look at yours. Let's see what's going on. And then you listen to me do the same thing with Kim or her daughter. And then now Julie's sitting here like, wait a minute, there are all these questions I didn't even think to ask. And now I'm realizing 90% of what I'm learning wasn't even through that thorough review and troubleshooting my case. 90% of what I'm learning right now is the case studies from the questions I didn't ask that somebody else is learning. And while I'm going through Kim, I'm going through Kim's daughter, Sally's results. And then I'm now going through the genetics. Hey, can you guys see the genetics between what's happening with Kim's food allergies and food sensitivities and what's going on with Sally's results? And that goes to my point. Our kids actually inherit 50% of our food sensitivities. There's a genetic basis to this.
Right.
And what does Kim having an autoimmune disease mean for Sally's results? Right. And then now Julie with low thyroid, for example, sitting like, wait a minute, my low thyroid, I just learned, was an autoimmune condition, 90% chance. I had no idea. Now I'm seeing Kim review her results with her daughters. I'm learning about genetics, and I'm also learning about autoimmune issues and the genetics of that and how it impacts on these test results. This is like, to me, like a genius method of teaching, like really getting personal results of training every single one of us to become the best absolute expert in a holistic approach and scientific and holistic approach into our own health. So it's not just about provider certification. The same materials and the same sessions that I'm actually working with patients on and clients on is the same sessions I'm actually provider certification candidates are going through. That's how smart these tools are when they're used properly and together in this type of setting. We can get every single individual, because here's the deal. You don't have to be a physician to have to learn to get a PhD or a master's degree on how to turn around and master your own health. You need it. It's your life.
Yeah.
Right?
Yeah. So do you feel like there is a certain pattern to these things that kind of is, because you said you're doing all these high numbers of people, like what's the pattern? What's the common denominator?
Many.
You said digestion for sure.
Many. I just listed one common denominator. Okay. Everybody's digestion is screwed up one way or another, and it was responsible for many downstream results. Like I just put dog chronic ear infection, but did you know that digestion is one of the underlying major thing that's broken for every single person with an autoimmune disease? For every single person that has POTS, dysautonomia, or long haul COVID, for every single person who's dealing with mast cell and histamine intolerance, at least 20 to 50% of the problems are stemming from a digestive problem that nobody even understands or knows exists.
Yeah.
The devil isn't the devil you know, it's the devil you don't know. So again, one of the themes is digestion, of course. But I alluded to a second theme. Major hormonal problems here. There are serious hormonal imbalances that are genetic, that are also environmentally introduced now, worse and worse, right? And that has to do with diet, nutrition, and environment, that are completely unrecognized. We have zero training for physicians, medical physicians, on what are these hidden patterns of hormone imbalances that's causing disease. And I'll give you an example. And this will work for you guys too with animals as well, which is when we ask anybody, let's say I'm going to use Julie as an example. Let's say Julie has low thyroid. Okay. Well, I'm going to bet you Julie nor her physicians know that 90% of people with low thyroid actually has an autoimmune basis for that thyroid. Okay.
Right.
Regardless whether the 2 or 3 thyroid tests are for autoimmune, it's positive or negative. And I'm going to give you a reason why. There are 6,000 targets of autoimmune attack in the thyroid alone. You do 3 tests of 3 targets, and then we tell people they don't have an autoimmune disease of their thyroid. Is that right?
No.
So if, 90% of people with thyroid disorders truly actually have parts of their thyroid under autoimmune attack, meaning their immune system is attacking it, but they don't even know how much. And let's go even bigger. That's where your immune system says your thyroid, which is a hormone making cell, is a germ and I'm going to kill you. Now, thyroid cells make hormones and they look very similar to ovary cells, adrenal cells, brain hormone making cells. Right. What's the likelihood, guys and girls, that your ovaries or testicular hormones are under attack, your adrenals are under attack, or your digestion, gut related hormones are also under attack? What do you guys think is the corollary there? Just knowing that Julie has low thyroid. What's likely that her ovarian hormones suck, right? Or her adrenals suck, right? 100%.
Yep.
And this is why you tweak the thyroid medication, and the person will still be like, I'm still fatigued, I still have the brain fog, my hair is still falling, I'm still gaining weight, because it isn't just a thyroid problem.
Right.
There's an autoimmune issue here attacking multiple hormone making organs, not to even mention the digestive issues for those with autoimmunity at play. So what I found is there are total themes, and that's why for me, we also have a program called my Hormone Masterclass, right? Where I work with individuals and physician certification to learn how do we test hormones accurately in people, right? And it's different for different age groups and different scenarios. So I use saliva hormone testing. How do we test them? How do we train them, on what are all these different type of patterns, hidden patterns? It's not whether each hormone is in the right spot in the normal range. It's how do these hormones, what are their levels showing you? What's the picture? What's the data story?
To each other.
100%, right? We miss that in thyroid training for medical doctors. We miss that in training for medical doctors. And medical doctors don't know how to test for hormones, and they certainly do not know what the hidden patterns are. And so we have people who don't get testing, and we have people who will get some testing, like blood maybe, and be like, oh, they're fine. And they're not. It's like a literal shit show. It's like a human bomb sitting there, and they don't see it. So I teach it. So the pattern here is you got to test, right? Just like we were talking about food and how we deal with food allergies and sensitivity. I do the same thing with hormones in our hormone program, which is testing, education on the hidden patterns, and live troubleshooting in small group trainings that we just talked about, where we get to say, hey, look at Kim's pattern in her hormones. And then what does that put her daughter, Sally, at risk for with her hormones? Let's look at those hormones together. It is like a nuclear educational truth bomb. Yeah. And so that's how you learn. And the thing is now Julie is watching. She's not only learning to help herself with her hormones, she's learning through Kim's example, what's the role of autoimmunity in her hormone pattern, and also how Kim's helping Sally. Julie's now thinking, oh my God, my daughter's hormones and my mom's hormones or my sister's hormones, and here's what I can do for it.
Right.
So that's a missing holy grail, is a really, for me, a Dr. Maggie approach, what I call a transform protocol approach to really dealing with hormones, which is an underlying pattern I see all the time.
So then this might sound like a simple or weird question, But so let's say you figure out that somebody's hormones are out of balance, their nutrition is out of balance, their digestion is out of balance. What's the methodology for bringing that all together and actually doing something about it?
What I just mentioned, right? Number one, you got to get the proper data education.
Right.
Number two, well, number one is data set. Right data set. Number two is their education. So for me, video modules and trainings around these concepts, because these are big, right?
Right, right,
That is independent learning is involved, right? I mean, think about mastery. Like, how do you master being a vet? Right now,
right.
how do you master being the pilot in your own health?
Of
Number
your
one,
body.
data set. Number two is your education. Number three, mentorship, like hours and hours every single week, depending on which programs you're talking about. We have a main
Right.
program, but, in our hormone program, for example, that would be an immersion week every 2 months over a 6-month time frame, right? Where we get to have these immersion weeks where we troubleshoot and work together. And once we go through the data set together, you're going to know, right, exactly what are the steps I need to do. In the case of hormones, let's use that as an example. Well, you're like, what's going to happen? Well, number one, you're going to understand, oh, let's say I have a pattern of PCOS, polycystic ovarian syndrome, that my physicians all miss. They don't even know what that is, or they said I don't have it. Well, they sure as hell have it. Let's say I have polycystic ovarian syndrome and there's a nuanced pattern of ABC, other things going on with it. And there's an autoimmune component and it's linked with my Hashimoto's, with my low thyroid. Now, let's say that's particularly your pattern. Well,
Right.
now you're going to be realizing, wow, is there dietary things that I can do knowing now that there's an autoimmune component to this? Yes, right? Everybody with autoimmune disease, you better stop gluten. Gluten is
Right.
a super trigger for all autoimmune disease,
Yeah.
humans and dogs and animals, right?
Right.
So that already is step number one. That doesn't require any additional data to know that gluten is going to be a problem for you. It's a super trigger for all autoimmune disease. Number two, right? Is now based on my hormone results, I know that let's say my estrogen is through the roof. Nobody wants your estrogen through the roof. That's going to put you at higher risk for cancer,
Right.
for stroke risk, for weight gain, insomnia, bloating, you name it, right? Everything. So, what are things that can be implemented? Well, if you're taking hormones, which many people are, and they thought they were good, you better damn lower that dose, right? If you're not taking it and you're freaking making it and not breaking it down, that's great because you know what? We can lower the rate with which you make estrogen through herbs, supplementation, and diet. We can also help you break down estrogen so many ways. I mean, for example, eating cruciferous vegetables. Cruciferous vegetables contain many bioactive compounds that actually help you break down excess estrogen, right? So, gosh, would it make sense? Let's say your dog has ovarian cancer and you know that's responsive to estrogen. Would it make sense to start feeding your dog more cruciferous vegetables in their diet, or a human for that matter? So, eating more cruciferous vegetables. And if, let's say, the human says, I don't like cruciferous vegetables or I'm allergic to them, are there supplementation that gives the bioactive chemicals in a supplement form that you can take that'll break down the excess estrogen? Hell yes. Right. So I love that, right?
Yeah.
So through diet, through their food allergy results, and the other piece is I can't eat cruciferous vegetables because it makes me fart. Well, okay, now you have a digestion problem with galactose intolerance. And
Yeah.
should you take some Beano when you eat those cruciferous vegetables? Yes.
Then you're
Or maybe
fine.
skip the cruciferous vegetables and just take DIM or take one of our supplements, Love Her or Defend Her. And that's going to be like, that's going to fix this problem. You don't even have to eat any cruciferous vegetables. You
Yeah.
can customize and tailor this plan for each individual because now we have tons of past medical history, symptoms, data, patterns here. And we got the world experts here going over this with you, and you're learning 10 times fast. So, oh my God, holy hell, many tools,
Yeah.
right?
Great. Yeah. So tell me about your deep dive into veterinary nutrition, because you
Yeah.
said that that was one of your latest hobbies. What's your goal there? What are you going to do with all that knowledge that you're gaining? Are you going to
Yeah.
start testing animals as well, or try
I'm
to
not
get
a veterinarian, so
veterinarians
I
on
can't.
board?
I'm not
Yeah.
a veterinarian, so I cannot.
Yeah.
My thing is to get the message out because I want to do a
That it's a
corollary
thing.
here. I want to light the fire in all your audience here because
Right.
it's not just about the animals; it's also about themselves. Of course, if you're a human and you're having any of these issues and it's resonating with you, like absolutely, I'm talking about what I do and what we do that's completely out of the box here, right?
Right.
My intention for veterinarian world is I just love it, right? Because I
Because
love animals.
you have your own dogs.
I have
You
dogs, I
told
have
me
cats,
before
I
we
love
started recording.
animals,
Yeah,
right? I spiritually, energetically really resonate and vibrate with the frequency of animals, tons.
that's
And
awesome.
so my thing with it is I educate everyone in my program about tons about that how they feed their animals. So it's so interesting, right? Because like in one of our programs where I'm working on gut infection, people will bring let's say I diagnose an H. pylori in a person where they have the ulcer causing bacteria. And they're like, this is the sixth time I dealt with it. And I go, I know. And that's why you're here with me now, because the reason you're getting is your dog is H. pylori as a carrier.
Mm,
And they're like, oh, and they didn't even realize it. Like there's a
right.
lot of things where human health and animal health actually go together, you know?
Yeah.
And here's the other thing is if your animal has food allergies going on, like the human, I'm telling you, also has food allergies going on. When you actually, I would urge many of you guys as veterinarians to start really thinking outside the box and be like, wow, like, chronic ear infection, fine, but what about digestion issues, cancer in pets, autoimmune disease in pets? You just heard what I said about gluten in humans. If
Right.
you have an animal with autoimmune disease, are you going to ask them to go on a grain-free diet?
Yeah.
Right. And then the other aspect of this is also like, I think it's really important to think about ancestrally what's an ancestral diet for our animals, right? What would our animals out there who normally would live long, right? If they, would live much longer, what were their bodies genetically, anthropologically made to digest and absorb and benefit the most out of? It
Right.
ain't grain, people. It
Yeah.
ain't grain,
Yeah. They're not
right?
out there eating wheat.
They're not here eating corn, like
Right. Yeah.
whatever, or wheat. They're not. But that's like, oh my gosh, look at the companies that make the most common pet food. 80 to 90% of the pet food you're selling out of your office
Hmm.
is made by companies that are actually candy bar companies. Just so you know, look at the Mars, look at Nestle.
Right. Yeah.
These are
Mars
the
owns a
companies
lot.
that are owning the pet food companies that you're selling food of that are quote unquote scientifically based.
Right.
Okay. Yeah, no, none of these diets is scientifically based to be what is the best diet for your animals. Okay. It's really important to really have just so much more of a thoughtful approach to how your pet owners and you are feeding not just yourselves, but your pets. And I see the back end of this problem where these animals will then need all these surgeries. They have tumors, they have cancer. They're going to cost their owners thousands and thousands and thousands of dollars later in their life. And sometimes as young as 5 years old, 3 years old, we're seeing cancers in dogs and cats.
Right.
Why? Like that's not naturally what actually happens to them out there, right? So I think we really got to take a hard look at you yourselves as veterinarians getting more educated about how to better meet the dietary nutritional needs of the animals, because that's a huge part of the problem. And how are you going to be contributing to the solution?
Right.
Right.
Hmm.
There's so much to learn about how to feed your animals. And I love it. I love learning how to feed, my dog, my cats, like thinking about what is raw diet. Should they all be on raw diet? I don't think so necessarily, but that could be right for some. Right. And then, should you cook your own pet food? There's some pros and cons for that. Right.
Right.
Should people be purchasing pre-cooked food for their animals? And if so, what kind of discernment should they go into that?
Right.
Because should it be whole prey? Think about that, because normally our cats and our dogs are consuming all different parts of animals. So then you put them on this diet that's all what the meat, all just the flesh. Is
Right.
that right? Also, what
Yeah.
about organ meat? Should they be consuming organ meat in their diet?
Yeah.
Right? And how do we make that happen? Right? Does it have to be hard and can it be easy? Right? So I just want to raise these questions for the
Yeah.
veterinarian world. There's a wake up call for conventional veterinarian in medicine docs that I want to ignite here.
Yeah.
And I want you guys to hear what I'm saying about your health and be able to think, how can I translate this same questions, same process, same answers type thing? How do I translate that into my practice to help thousands and thousands of animals and pet owners?
Yeah. Yeah.
That's a
Well,
movement.
I talk a lot about mental health in the things I do, and all of this does relate to that. Like gut
Yes.
health and mental health is very closely related, and how you feel every
Yeah.
day is going to
Yeah.
influence how you think and how your mental health is progressing or not progressing, I guess I should say.
Yeah, let's look at some animal corollary to this, which is, poodles have digestion problems. Poodles have irritable stomachs. I don't know how many times we've heard this. We can find this. We can Google this. It's true,
Right.
right? And we also like now more and more poodles and doodles are becoming more and more high anxiety breeds. Doodles are becoming, these very hypoallergenic dogs for humans. But the
Right.
problem is that they're also now more and more in that breed, higher and higher levels of anxiety. We're seeing a lot of them being medicated,
Right.
right? With Prozac, and all that. And so the thing is that I can tell you right now, as an owner of a doodle that I fostered and adopted, um, that his diet had so much to do with this. And having GI symptoms all the time, how much of that is contributing to his anxiety, to his
Right. Yeah. If they
irritability, to
don't
his
feel well.
hyperactivity? How many of our doodles and poodles are not feeling well from a mental health standpoint, from a behavioral standpoint?
Right.
And it's stemming from their digestive and food allergy issues.
Yeah. Yeah.
Big
I love
time,
that.
right?
Yeah. It's amazing.
Right. And
Yeah.
so, and I learned a lot from dealing with Noodle, my doodle over here, who's sleeping right next to me on the ground. You know, I learned
His name is Noodle.
his name is Noodle.
I
He
love that.
came with that name. Um,
So you kept it.
and I've learned so much from Noodle, and when I met him, he was 9 months old and crazy level of anxiety. And he's big. Like we have these dogs
Right.
like Danes and Doodles that can be big, and they
Right.
just because they're big don't mean they're not puppies.
Right.
And then if they're big with behavioral issues, they become more and more some of the most, some of these larger breeds that are big puppies end up being returned to shelters all the time, right? Because they look big, but they're giant puppies. And so these behavioral issues for me is something we should think about. I mean, there needs to be better education of owners, like what it means to be a pet owner, right?
Right.
It's a
Right.
huge investment
Yeah.
financially
Yes.
and intentionally and emotionally. Like the first year of Doodle's life after we adopted him, I invested a ton in learning what it means to train, right? To provide training and consistency in a household, my husband and I, in training him. And very quickly, you saw these behaviors resolve,
Right.
right? And for me, that's thinking through as a responsible owner, like you got to think like a dog, and got to think about what a dog really needs to have these behaviors shift. And that's a very holistic way of looking at behavioral issues in animals, right? It's
Right.
not just, oh my gosh, this dog keeps jumping on everybody. And a lot of people just like fix it. They want it fixed, or they will just give them to a trainer and fix it. Well, what are you doing at home to think through that problem with consistency to foster that behavior, not only to set, but to continue and to become automatic, right? That is a holistic approach to behavior in animals that we need to apply to humans as well. We got to think through these problems on a deeper level, the root
Yeah.
cause. What is the root cause of nipping on your hand for puppies, right? How do we nip that behavior in the butt? But we got to think about, well, what's causing that? What's the psychology for that dog? What can I do now to intervene while loving that animal, right?
It's all
And
about digging in,
it's
doing your
about
research
boundaries,
and
is
digging
digging.
in. Yeah.
Yeah. I work with my clients on mindset. And one of the biggest patterns I see is a lack of healthy boundaries that people have with people.
Right.
And when you have lack of boundaries when it comes to people in the world, this is how disease settles in mental health. And so I find that a lot of training and working with our animals is setting boundaries, expectations, the framework for success. 100% these lessons apply to how we train and work with our animals. right? So I see a lot on your podcast around like mental health piece and how we deal with it. I would love for people to start applying that to thinking through. We should be doing the same with that with our animals,
Absolutely. Yeah.
right?
Yeah. Absolutely. So before we start to wrap up, is there anything that we didn't talk about that we should, that we're missing?
Yeah,
You've given us a lot of information.
I think what people
I
are going
love.
to do. I want clear action steps for people. What's a blueprint?
Okay, you tell me what that is.
I'm going to tell people right now, for you and anybody that you know in your family that is suffering from any sort of health related symptom that you know isn't being addressed by conventional medicine. I'm going to tell you there are answers and there are solutions. But part of it is you already now have access, and you know that I have said some truths here that you know are making the connections. You know it's true,
Right.
right? So on you, first step number one is if you're suffering with it or anyone you know, go to my YouTube channel. My name is Dr. Maggie Yu, and type that symptom in or that diagnosis in, because I deal with every diagnosis known to man. Doesn't matter. I don't even care if you don't have a diagnosis. Give me the hardest symptom you got. I got 10 videos on that, right? And so for me, you now have access to someone who eats these problems for breakfast. So I want you to make
Does
use.
all the research for us so we don't have to do it, right?
Here's a resource. Access the resource.
Right.
Number one, YouTube channel search, right? To educate yourself. Number two, I'm going to offer you my book for free. Okay.
Awesome.
I'm going to offer everybody in the audience here my book for free. So in the show notes, when you watch this, so be a link. And my book is 10 out of the box. I'm sorry, 8 out of the box ways to transform your health. And it's a playbook because I'm all about action steps.
Right.
Right. I talked about digestion. I talked about hormones. I talked about nutrition. I talked about a variety of different things, even microbiome and infection. So every one of these things I've talked about, there's a chapter in my book on it because it's one of the 8 lessons. And at the back of each chapter is action steps. So if you're like too long, don't read, fine. Flip to the end of the chapter. I got action steps for you.
You've got the cliff notes.
I got the cliff notes because I know I'm a busy doctor too, right?
Right. Right.
So I would say get the book, right? And then number 3 is reach out, connect. Again, I started this interview by saying that my number one value is connection. What drives me in what my passion is, yes, I have a passion in veterinarian medicine, holistic veterinarian medicine, and human medicine.
Right.
But my number one passion desire is to connect. So you know what? Reach out and connect. If you go to my website, drmaggie.com, we have chat there. You know, you can connect with us. I have a Facebook group with 100,000 people, members in it so far. We're I think 96 or 98,000. So my Facebook group is Transform Your Health Naturally. And I have tons of people from podcasts that just jump in and request to join Transform Your Health Naturally. We'll provide that link in the show notes. Click the link, request to join the group. And that's a great community with which people can ask questions, people can share. You can access our team live, and we could get answers and resources to you. I have so many training resources that are free, right?
Yeah.
Access it, utilize it, right? And then when you're ready to really take some action, you're like, I want to work with her on hormones. I want to work with her and her team on food allergies and sensitivities. I want to work with her on my autoimmune disease, my thyroid. We're here. Reach out.
I love that. Well, this has been so fun, and you have so much great energy. I love it. Is your dog right there?
My cat
Your
Beast
cat.
is pawing at the door right now. And
Oh,
so
I
let
see.
Beast
Wants
out.
to go out.
That's my long hair. That's Beast. Bye.
I love it.
So all my animals are in here. So that's why I was like, Beast is
Yeah.
like, you know the drill.
Oh, yeah. Yeah, I do.
Yeah.
Well, I really appreciate you being here. It's been loads of fun. I've learned a lot. I'm definitely going to go to your YouTube channel now and watch some of your videos and get educated. I love that.
Hey, one more thing. I would
Okay.
love for everybody who's watching here, go to the show comment section here. And if there are additional questions that you have that you would love to get
Oh,
answered,
yes.
go in the show comment section. Tell me what was one of your biggest aha, one
I
of the
love that.
truths that you learned, but also like tell me and tell Julie here, what are some other questions and topics you would love to go deep dive on more? Because I read every one of these comments on all my videos. I read every single one of these comments, and that's
Yes.
what gives me ideas to
Right.
provide more content on. How
Okay.
can we serve you better? So
Right.
in the comments, Julie's going to read it. I'm going to read it. And if there are other topics, I would freaking love to come back. I would love to come
Oh,
back and
sure.
explore other topics deeper. If you as the audience wants it, I will deliver. So put
That's
it in the
awesome.
comment section.
Okay, that sounds great. Well, everyone, I really appreciate you listening today. This is Dr. Maggie Yu, and go check out her YouTube channel and learn all of the things that she's talking about. You're so passionate. It's so fun to listen to you, and I really appreciate you being here.
Thank you. Thanks. Thank you, Julie, and thanks to your audience.
All right. Have a beautiful week, everyone. Bye. Bye, Maggie.
Bye.